Has Prince Harry had a hair transplant? Today we'll be looking at Spare author's hair transformation over the years. Watch till the end because we have an update from a recent Prince Harry video from this month. In 2002, at the age of 19, you can see that Prince Harry has temples that align with the lateral aspect of his eyebrows. This, of course, is a very youthful appearance. Notice how strong his crown hair is. More on that later. In 2003, at the age of 20, given the low hairline, his upper third of the face appears shorter than the lower third of his face. The low hairline also creates a well-framed face. In 2004, at the age of 21, Prince Harry has a great hairline for being 21 years old, but this hairline doesn't work well for someone who's much older, and this is why when people come in for a hair transplant requesting this type of configuration to their hairline, it's not recommended, but it does look great at 21. We have a video on why men should not lower their hairlines. Make sure to check that out. In 2005, at the age of 22, you can see that Prince Harry has a widow's peak. Now, a widow's peak is found in about 30% of men and women. The use of the peak refers to the beak or the bill of a headdress, which widows wore as a hood of mourning dating back from 1530. In 2006, at the age of 23, there are very early signs of right temple thinning, but notice that the hairline shape is overall well maintained. 90% of the time, the right side of the temple or of the frontotemporal angle is going to be thinner compared to the left. It also is usually the side that's more recessed. No one knows exactly why this is, but it's something that I notice in my practice and something that's been documented well in the literature. Now, in 2007, at the age of 24, the shape of the hairline is starting to change. It appears less flat and less straight. The corners are starting to develop. In 2010, at the age of 27, there's increased height to the temples as the hairline has started to slowly recede. This also creates increased forehead height. But he's still all smiles. In 2012, at the age of 29, there's crown loss that you can now see. To go over some of the basic anatomy of the scalp when it comes to hair, especially hair restoration, we think of the hairline that, of course, frames the face, and that extends from the temples into the central hairline and then over to the other side. There's the frontal scalp, there's the mid-scalp, and then there's the crown. And then the donor area typically is the occipital and parietal scalp, or the back of the head onto the sides of the head. Those are the most common areas to both transplant to, which is the recipient area, and to transplant from, which is the donor area. In 2013, at the age of 30, we're starting to see some density differences between the DHT sensitive zone and the DHT resistant zones. And this is a reasonable time to start medical therapy, because people ask me, when do I start? Should I have started when I was 18 years old? Not necessarily, but when you start to see these early signs of thinning, that's a good time to consider medical therapy. For first-line medical therapy, we think of finasteride and minoxidil being great options for most people and being taken together, and we prefer them as pills because they're more effective that way. To learn more about medical therapy for hair restoration, head to feelconfident.com. In 2014, at the age of 31, there's increased depth of the frontotemporal corners. People will often ask me about the Norwood scale. In a consultation, they'll say, what's my Norwood scale rating? What would you rate me? And my answer is oftentimes, especially in a clinical setting, who cares? And that sometimes throws people off guard, but the reason for that is that there are many different clinical variants of hair loss, or specifically of male pattern hair loss or androgenic alopecia. And I don't think that most people fall into the strict categories that are assigned by the Norwood-Hamilton scale. So in clinical practice, it doesn't so much matter if someone's a Norwood 2 or 3 or 4, it just matters what their specific pattern is and how we plan to address it. Before we continue, make sure to subscribe to the channel and turn on all notifications. In 2015, at the age of 32, I'm seeing slight weakening of the right anterior temporal peak. This is usually the start of the temple starting to recede and thin out. It starts there in the front, and you start to lose that anterior peak first. And what that does is that it makes the forehead look more expanded, because you're not just losing hair in the sense that the hairline is receding up, but it's also because the sides went back, the temples receded back as well. So when we look to rebuild the hairline, we have to first see if there are enough grafts to invest into the temples to build them up. But if that's possible, that usually is a nice addition to someone's hair restoration. In 2016, at the age of 33, Prince Harry's crown loss appears to be worsening. And in 2017, at the age of 34, I think Prince Harry may have had a hair transplant around this time. The procedure could have been anywhere from 1,200 to 1,800 grafts, possibly more, and the likely recipient areas were the hairline and the frontal scalp. In my clinic, we're performing on par with the world's best clinics, and we have over 60 years of combined hair transplant experience between myself and my staff. We're looking for patients who appreciate great quality. If that's you, contact us. There's more information in the description below. In 2018, at the age of 35, the results of his first potential hair transplant are now more evident at the hairline. There's a nice natural appearance to the hairline, and we've already released a video on hairline design that I encourage everybody to check out. It goes over what makes a natural hairline. First and foremost, just the way it appears without any surgery, and then what do we do in surgery to try to recreate that same type of naturality. And now it looks like Prince Harry's crown loss is more extensive. In 2019, you can again notice the shape change of the frontotemporal areas. They appear less rounded than they did in prior years before the potential hair transplant. And in 2020, at the age of 36, I see no change. In 2021, at the age of 37, you can see that Prince Harry's hair has continued to thin. Now, this might be because he's not on any medical therapy, or he's on medical therapy but just isn't stable on it. Perhaps he discontinued finasteride due to side effects that some people get, and maybe he just decided not to try anything else. But there are other forms of medical therapy, and we've spoken about them extensively on this channel. They include things like low-level laser light therapy, platelet-rich plasma, microneedling. And when someone is on a standard dose of finasteride of 1 milligram a day, and let's say it's not working for them, what we usually do is recommend switching to the brand name Propecia and trying that out. If that doesn't work, we can always try a higher dose of finasteride or bump them up to dutasteride, which is the stronger cousin of finasteride. Very few people have breakthrough hair loss on dutasteride, but the problem is that the side effect profile is worse on dutasteride compared to finasteride. So we don't start with dutasteride, but for some people, it's a good option if they continue to lose hair on finasteride. In 2022, at the age of 38, you can notice the color difference at the hairline when you look at this image between the transplanted grafts and his pre-existing hairs. And this can occur with a hair transplant where you're taking hair from an area that might have a slightly different coloration and you're moving it to a new location. The hair will usually retain the coloration that it had from its original location. And in 2023, the majority of the hair that remains at the frontal scalp, I believe, may be due to his hair transplant. At this point, Prince Harry has about 30 to 40% of his original density in the frontal scalp and about 15 to 20% of the original hair density in the mid-scalp and crown. Even if he were to get additional hair transplants, it wouldn't bump up his density to the original. That is a point that is important to make because oftentimes when people get a hair transplant, they come in thinking that they're going to get complete restoration and look just like they did when they were 18. But the problem is there really isn't enough hair in the donor areas to accomplish that, especially for someone who has extensive loss throughout the frontal scalp, mid-scalp, and crown. So one must go into hair transplant surgery with very realistic expectations to get a result that they're ultimately happy with. And also we need to realize that people do get additional procedures over time to increase density. And on August 2nd of 2023, Prince Harry was on a call related to his foundation, and the sun was reflecting off of his crown. But there was another area on the occipital scalp that was illuminated. While a bit low, it does look like a potential FUT scar, and it's more visible now that his hair is cut shorter than he usually wears it. Worldwide, most men are getting FUE hair transplants these days, but there is still a role for FUT surgery. Check out this video to learn more about FUT versus FUE hair transplant surgery. Since you like this video on Prince Harry, check out one of our other videos on hair loss.